This episode of Doc Talk is brought to you by the Kappa Boot Scootin' Ball, featuring the president of the Redneck Yacht Club himself, Craig Morgan. Join us Friday, April 5th for the Knoxville's most talked about fundraiser of the year. The event will be packed with great country music provided by Craig Morgan, line dancing, Western-themed dinner, bottomless beverage, and an exclusive Kappa Boot Scootin' Ball souvenir mug. Additionally, a silent auction valued at more than $40,000. We have the opportunity for those in attendance to bid on some packages, including a Dynasty Spa. For tickets, visit kappabootscootin.com.
Hi, welcome. We are happy you can join us this afternoon for Doc Talk. Doc Talk is the podcast put out by the Knoxville Academy of Medicine, which gives dialogue about health problems in plain language. I'm Elise Denaney, former president of the Knoxville Academy of Medicine, and hosting today's podcast. Today we have joining us a good friend, Dr. Robert Elder, who is the chairman of the University of Tennessee Department of Urogynecology. I'll explain what that is because that's a new one for me too. He also chairs and is president of the University Physicians Association at the University of Tennessee Medical Center at Knoxville. So happy that you can join us today, Bob.
Thank you. I'm glad to be here.
I like the new look that you're sporting too. It's very handsome.
Oh, well, thank you.
So, urogynecology.
Well, it's just what it sounds. It is a combination of a specialty that deals with problems of the lower urinary tract and the pelvic floor in women. So we deal with pelvic floor issues, urinary incontinence, fecal incontinence, pelvic prolapse, those type problems among others. And so we're really considered pelvic floor specialists.
That's amazing because, you know, we think about that as, obviously I'm a woman. I love women's health. And we have several issues starting from adolescence all the way to 80s that involve very, very specialized issues down in the pelvic floor. Tell me what you normally see mostly.
Mostly we probably deal with incontinence issues, really a lot of what's stress incontinence, which is that kind of loss of urine that occurs with cough, sneeze, and physical activity.
Guilty. Don't
Yeah, there you go. Well, there's treatment for that. And the other thing we see a lot, and everyone has seen the commercials on TV, the gotta go, or my favorite one is the bladder, dragging the lady through her bladder's dragging her through the shopping mall or whatever.
Right.
So that's overactive bladder. So two of the most common things we deal with are stress urinary incontinence and overactive bladder. Then the other problems we deal with very common is some type of loss of the pelvic support, either prolapse of the anterior vaginal wall or the posterior vaginal wall or the uterus itself, or pelvic organ prolapse.
So how do they relate to each other down in that area of our body? Like it was one in front of the other or behind or side by side, and just trying to get a feeling of how.
Well, if you look at it, you look at the vaginal vault. Top of the vaginal vault is the uterus. And of course, you know, that's where the babies come from.
Right.
And one of the most common causes of pelvic floor issues is associated with pregnancy and childbirth. And then the bladder lies just over the top of the cervix and the vagina, and the urethra that drains the bladder is just below that. And then on the other side of the vagina, you have the rectum. So all those organs are adjunct to each other or near each other, and they're all supported by some of the same pelvic structures.
Like a big sandwich.
Yeah, sort of connective tissue and muscle tissue, almost forms a hammock and helps support that area and keep it in its proper position.
So when we have a baby, everything kind of gets really stretched. Am I right?
Yeah, that's a common explanation.
I'm wrong.
No, you're not wrong. You actually are right. But there's a lot about these problems, how they originate, we don't understand. We know that people can have a C-section and still have pelvic floor problems, so it's not all associated with labor and childbirth. The pregnancy itself may cause some muscle damage or nerve damage or connective tissue damage that leads to these problems. And but yes, that's right. So it's not just the stretching of the tissue, but it may be associated with other types of damage too, such as nerve and connective tissue damage. And also, there's a lot of studies now where they're like doing MRIs and things like that to try to determine just, what is causing these type problems. So in one way, we're a relatively young field, and so a lot of this is still being evaluated. But that's not a bad explanation.
Okay, well, thank you. You're too kind, too generous. So, sometimes women get recurrent urinary tract infections that the doctor will call a UTI. And I know several friends, they get a UTI, they get placed on antibiotics, it clears up, then it comes back. They get the pain, they get the pressure, they get the frequency. They go back to the doctor, they get another UTI, and it's at what point in time do we say enough is enough and we say there's a real cause?
That's a really great question. Number one, when we evaluate somebody for recurrent UTIs, we want them to have had cultures, because a lot of these are diagnosed by dipsticks in the office, and those are very nonspecific screening tests that can be used to identify and maybe treat folks. But if you have someone that's having recurrent issues, you need those documented cultures. So if someone has 3 to 4 documented UTIs in a year, or 2 to 3 in 6 months, then we're going to consider that person to have recurrent UTIs. Now, what can be some of the causes that we need to worry about? And do we need to worry about just the bladder and the urethra, or could it be something higher that may involve the upper urinary tract with the kidneys and the ureters? So the way we evaluate those, again, we want documented cultures. If the patient's having some other reason that may be causing these, we may go ahead and want to treat that. For example, in the menopausal patient, it's often vaginal dryness or vaginal atrophy. And the thinning of the vaginal tissues have made that tissue and the urethra and the bladder more susceptible to the infection. And sometimes just something as simple as treating those patients with local estrogen therapy will prevent those recurrent UTIs.
Make me a happy woman.
Well, often it's amazing. They're very appreciative when you do that. The other thing that you sometimes see is it might be after someone has had intercourse or been intimate. And if that happens frequently, there's some things you can do, like to make sure they empty their bladder before and after. But some patients, after a thorough evaluation, there's not another etiology, just have to take like maybe 1 dose of an antibiotic right after intercourse. So, there's ways to treat these. But then you want to go ahead with these people who have true recurrent urinary tract infections and do a full evaluation. And that would include the cultures, a cystoscope.
A cystoscope, what's that?
And cystoscopy, looking into the bladder.
Okay.
And we can do that in the office. Almost any urogynecologist, urologist has the ability to do a cystoscope in their office, and it only takes a couple of minutes.
Okay.
And then the other thing you do is you do a CAT scan or a CT scan to check out the kidneys and the ureters to make sure you're not missing something above the level of the bladder that might be contributing to the infections.
Okay, I think I got that. It's really funny when they say, they give you this little plastic cup, go get a culture. And they say it's really important to get a clean culture. What does that mean?
Well, really a clean catch.
Clean catch.
And what it is, if you think about the relationship of the urethra, or the tube that drains the bladder, the vagina, and the rectum, where obviously the bowel movement exits, they're very close to one another.
Right.
So that area of the body is very common to have some bacteria that is near that area. So if you don't do appropriate clean catch, you can get contaminant. And that's why you want a nice clean catch urine. Doesn't have a contaminant, doesn't have a lot of mixture of what might be considered normal bacteria, which we all have, and so that you can make sure you're dealing with the infection.
That's wonderful. So we're going back to the vaginal area, okay? How often does constipation, when they can't get their BM out, or recurrent urinary tract infections then do the reverse and affect happiness when they have sexual intercourse and things like that?
Recurrent urinary tract infections, that's another important thing to think about, especially if there's pain associated with it. And you really don't think of recurrent urinary tract infections causing pain with intercourse. But what you do think about is another problem called interstitial cystitis, or maybe called pelvic pain of bladder origin, meaning they have discomfort. And these patients often have signs and symptoms consistent with a urinary tract infection, but they have negative cultures. They're often treated for urinary tract infections based on a dipstick or symptoms when they don't really have it. And they may see 4 to 6 physicians where someone makes this diagnosis, and this diagnosis of interstitial cystitis or pelvic pain of bladder origin is really a chronic inflammatory problem of the bladder that is not treated with antibiotics, but is treated with behavioral therapies and some surgical therapies by dilating the bladder and reducing it to treat it, and sometimes by a medication called Elmiron that replaces a mucus layer that's missing in the bladder that protects the bladder.
That's fabulous.
So when you have, that's one of the reasons you want to make sure if you have recurrent, quote, urinary tract infections, you're getting documented cultures, because what if it's another problem and you're continuously getting treated?
Yeah, because not all pain is from either a bacterial or fungal infection. Sometimes what's going on is, for some reason, your bladder just tells your body, I'm all irritated. I'm not quite sure why I'm irritated, but the lining in my bladder is irritated. But it presents as the same way as an infection. Yes. So it's good. It's important.
That's good. And those patients are often treated for infection over and over before they finally see a provider who says, hey, I don't think this is an infection. We need to investigate this more.
That's great to know. Okay, so because you don't want to be treated with antibiotics and you don't really need antibiotics.
Correct.
Okay. So do people who are diabetic or hypertensive or who have other diseases or smoking, are they more prone to these problems?
You can almost any time say obesity, diabetes, and smoking, and you can hit almost anything that makes it worse. And there's a couple of issues there. Of course, a lot of these pelvic floor problems, especially the prolapse, the stress incontinence, those things we treat surgically. And people who are diabetic, of course, are more prone to urinary tract infections. But from a surgical standpoint, the healing is an issue. If you're diabetic, you're a smoker, those things are things that make healing more difficult.
Don't heal as well.
Right. So you love for those patients to stop smoking and control their blood sugars and that sort of thing, especially if you're performing a surgical procedure.
Yeah, you don't want to fall apart.
Right.
Like, make me tight, doc. Don't let me fall apart. All right. Well, that's good to know. Well, that kind of talks about urogynecology. So this is a new field that is relatively new that involves the urology part and the gynecology part, and it specializes in understanding pelvic floor problems. Lots of new stuff on the horizon, which is great to know because it's women's health, and I think we're kind of special. That is biased, but I kind of think that.
I think you are too.
If we have more questions on urogynecology, how do we get a hold of you?
We have a website,
okay.
uturogynecology.com, and I have 2 partners. All 3 of us are board-certified urogynecologists. And then also our office is at UT Medical Center. The number is 305-5940. We also have offices in Lenoir City and Sevierville.
Lenoir City office, Sevierville office, getting close to telemedicine?
Not at this point, but it's coming.
That's right. Who are your partners?
Dr. Bryce Bowling, native Knoxvillian, UT graduate, and went to UT Medical School, did his residency there and his fellowship at the University of Alabama, Birmingham. Dr. Michael Poland, who's from Indiana, went to University of Indiana and then to medical school there. And then, or I'm sorry, he'll get mad at me, he went to Miami of Ohio. And then he went to medical school at Indiana. He would be very distraught if I and then he did his residency at UAB and his fellowship at Duke.
Amazing.
So we have a very good group of people. We also have pelvic floor physical therapists we work with. We work with the colorectal surgeons with some of these problems. And of course, sometimes we work with the urologists. So it really is a multidisciplinary type of practice.
It sounds like a well-trained, well-credentialed, comprehensive team dealing with my problems.
We think so.
Well, thank you for joining us today. There's still more to come on urogynecologic problems, I'm sure, so stay tuned. And today, that's a wrap. Thank you.
This episode of Doc Talk is brought to you by the Kappa Boot Scootin' Ball, featuring the president of the Redneck Yacht Club himself, Craig Morgan. Join us Friday, April 5th for the Knoxville's most talked about fundraiser of the year. The event will be packed with great country music provided by Craig Morgan, line dancing, Western-themed dinner, bottomless beverage, and an exclusive Kappa Boot Scootin' Ball souvenir mug. Additionally, a silent auction valued at more than $40,000 will give the opportunity for those in attendance to bid on some packages, including a Dynasty Spa. For tickets, visit kappabootscootin.com.